Good morning, everyone. My name is Dr. Rohit Kumar Jindal. I am a practicing dermatologist in Karnal and Kurukshetra by the name of Jindal Skin Clinic. I am working as a dermatologist since 2013 and I am using some of the products of Derma India, and we'll be talking about some products of Mystic Array, that is a division of Derma India, that is the Pico laser and the Capstone, the dyed laser, that is having a 4 hand pieces. First of all, today I will discuss about the laser hair reduction. The machine what I am using is the Capstone machine of the Derma India. This is a diode laser with triple wavelength. It is having a 4 heads, that is the 4 types of the lenses, which is having, one is the large lens, and second is the medium type of the lens, and third is the small size, and fourth is the tip, nose tip size. Okay, that is a facial tip also. All of them have different sizes, like this is having around 13.5 millimeter to 38.5 millimeter, and this is having 13.5 millimeter to 28.5 millimeter, and this one is having 12.5 millimeter to 14.5 millimeter, and this one is having 5 millimeter. The beauty of this thing is we can use the hand pieces to any type of things, like the large handpiece you can use for the body laser hair reduction, the medium type you can use for like your axillary area and the private part areas, and the small type you can use on the face, and the facial tip, this you can use over the nose area, ear area, or the small area you want to get the laser hair reduction. One more thing, this is the triple wavelength laser, so this helps in getting clear the thick hair also, blonde hair also, thin hair also. So it works in all the types of hairs, that is the thick hair, thin hair, and the blonde hair. This machine is having 3 modes. One is the professional mode, normal mode, and fast mode. We can click on to any mode and you can choose the parameters. So we are putting one hand piece, that is a small hand piece. So it's very easy to put. Just remove the cover of the handle and it has a magnet which easily fits on it. First of all, we need to choose like whether we are using woman or man. So I am putting the man, and my first patient I am doing is for the beard reshaping. Okay, so this I have choose with the Fitzpatrick third skin classification. Generally it shows like 1 Hz of the frequency and 15 joules per centimeter square of the fluence. I generally decrease it because sometimes you get more of irritation or more of like pain. To decrease the pain, we can reduce the energy also. So this is my settings for the beard reshaping. So our first patient is for the beard reshaping. First of all, make sure like the patient's hairs are removed with the help of the razor. Don't use thread, don't bleach the things. Always remove with a razor. Do it with very in a light mode. Don't do over pressure. Don't press it. It's always better to remove the pending hairs with your micropore tape, so that the hair should not capture the light of the diode laser, that is the cut hairs. Then always put a margin of with the help of your tape, so that you don't burn the beard which you don't want to burn. Then put the eye glasses. Always wear your eye protection also. Then put the gel. This is an ultrasound gel, and gels are of many types. It's better always use a clear gel that should not have any color. If the color is there, then it will absorb the light of the diode laser also, and the chances of burns could be there. See the tip, it's very chilled out, and so we are not putting ice also, because this is all like already pre-cooled tip. You can use the stamping mode also, and you can use the in motion technology also. In that, if you want to use in motion technology, you should always take a frequency of 2 or 3. Feel the smell also of the burned hair. Let's see the redness part also. There is very mild redness, and the patient was very comfortable, and there is no blebs or like any erythematous or like any burn things are there. Patient was very comfortable. If the patient feels any heat after this, then you can apply a ice. In the last, you need to apply a sunscreen. Always tell the patient to use sunscreen 3 hours, 3 hourly, like 9 in the morning, then 12 o'clock, then 3 o'clock. Don't bleach the area. So if you do waxing or bleaching of that area, the results of the laser hair reduction will come down. You can ask the patient like come after like 1 month, and avoid sun exposure as much as possible. It's a very smooth process, and it's a very easy process, and you will get to see the results in like 3 sessions or 4 sessions. The thinning of hairs will be there, and then some density part will come down, and eventually by the settings, like the hair will go reduce and by reduce. So it's a reduction, it is not a removal actually. It's always a reduction of the hairs. Same in this patient, like he is having in between the eyebrows also. So in this area, I prefer to use my facial tip, because chances of burning the nearby area is very rare if you use a facial tip. So this is a facial tip. This is the same process. We just need to remove the previous lens. Just put this new lens. This is the facial tip lens. This is the cover of this facial tip lens. Come इसको खींचिए. This is a fixed for this facial tip. This is the frequency will be 1 and the fluence will be 1. It is not burning the nearby things. It is having a target lesion. See, it is targeting. So this is all reduction. Generally, like in full body hair reduction, we use this handpiece. Okay, and in this handpiece it takes at least 2.5 hours to do full body hair reduction if 2 attendants are doing the laser hair reduction for the full body. If your shots are finished with the small this thing, you can use your medium part also with caution on your face also. It's a positive point for this thing. Thank you so much. Thank you so much.